Hello, my fellow clinical laboratory scientists. This is Mark, and today I'm going to show you how to do a DAT test, the Direct Anti Human Globulin test. If you have not seen this test before, or you've been studying about it, and you do not, don't know how to perform this test, this is going to be very helpful. I'm gonna use a cap, not real patient, but this is likely not real patient due to the fact that CAP is one of the regulatory agency, and their test is there to mimic the real patient. So I have three sample in here. I'm going to do a DAT test on those samples. So I'm gonna use the gel method. This is Pali. I don't know if you can see. And Pali specific has the IgG and C3D on it. And if anything positive, and I will do an IgG and a complement to see which one is in the cell. Now, a little theory before I start. So the DAT is done on patient that has red blood cell sensitized. We do a DAT to find antibody coated RBC. So this is ASAP question. Make sure you know those answers when you go take your ASAP exam. And if you want to know more about ASAP, I have videos on this channel that tells you how to pass your board certification ASAP. I'm going to wash my cells. A real patient, you wash your cell 3 times. And you wash your cells before. This is my red blood cells, and I have 3 samples. Okay, so in a real patient, you wash your cell, and that's what I'm going to do. I'm going to wash those cells, and then after you wash 3 times, and you proceed. Okay, stay with me. I'm gonna mark my tubes 1, 2, 3 from cell 1, cell 2, and cell 3. Going to add 1 drop of cell 1. Cell number 3. Now the next step is basically to wash those cells. So now, since I'm doing a poly using the microtyping system, or what we call this, this is special saline, so I'm going to dilute the cell. Okay, stay with me. Okay, so the wash is 3 times, and I'm gonna fast forward this. Okay, ladies and gents, this is my suspension. You see that? Cell 1, cell number 2, and cell number 3. So now I'm ready to pipette to pipette the cell into the polycard, incubate for 15 minutes using the ortho workstation, and then I'm going to spin for 10 minutes. Okay, but it's gonna be faster than that, so you're watching the videos. So let me set this up to, so make sure it's depend on, each laboratory is different, so it's depend on your system, the laboratory that you work, that will tell you how much red cell to pipette. So mine is 50. Okay, pipetting is a technique. It takes practice. So if you not use the pipette and be patient, you'll be fine. It takes a little practice to master pipetting. Like you can see, I'm using my hands to stabilize the pipette. So some people are steady hand can just pipette like this, but you know, I need a little help. So any technique that you feel comfortable while using the pipette, use it. Make sure that you're not contaminated anything. See, 1, 2, 3 cells, incubate for 15 minutes. And I know it's gonna be very fast for you. At the meantime, I'm going to show you this. Hopefully you can see it, can you? This is anti-IgG. If I have AD positive, I will want to know what it is, if it is an IgG antibody or if it's a complement. So I will want IgG and complement, and I'm gonna do the tube method for that. Barley is, well, in our laboratory, it's gel. It's very reliable, great reaction. And any positive, I will want IgG and complement to make sure, you know, if it's IgG or complement or both. Okay, so this is IgG, and I'm gonna get the complement anti-sera reagent. All right, ladies and gents. Okay, so incubation is finished. Now I'm spinning for 10 minutes. So, like I said, any positive, I will want anti-IgG, and I will want complement. All right, complement. So, and those two, I'm gonna do tube method. So now, one thing I want from you guys, I want you to put in the comments, when we have a positive DAT, what will be the next step? What we should do in order to identify this antibody? Okay, so put it in the comments, and this is the SAP question. So please put the comment, keep them coming, okay? So still you know, spending for 10 minutes, and then I'm gonna make it go a little faster for you guys. All right, that was very fast. And look at this. Let's see. Let's move closer. Can you see? All right, I think you can see. Right? So cell number 1 is positive. This cell. 1, 2, 3. Okay, this camera is kind of upside down or whatever. So I have a positive cell number 1 with a 4 plus positive. Okay, so what I'm going to do now, cell number 1, I am going to run an IgG and complement on it. Okay, so IgG 1 drop, and make sure you differentiate your tube. And also, like you can see, IgG is kind of green and complement is clear. So this is another way to differentiate them. So make sure you know which tube is which. Okay. 1 drop of IgG and 1 drop of complement. And then we're going to spin for a few seconds. Fast, and let's read this together. Let's go with IgG. Okay, I'm gonna suspend this. Okay, so let me see if I can make you see this. Can you see? Oh, it's kind of like hard to see it. Let me see if I can make you see this reaction. Can you see the reaction? Okay, so hold on. Let's try this. Okay, what? All right, so IgG is positive. It's positive. I need to make you see this, but I don't know. Let's see. You know what? Okay, so. I don't know if you guys can see the clamps. See that? It's kind of like, well, it's like a 2 plus or 3 plus positive. Okay, so I'm checking complement now. Okay. Oh, sorry. All right, there you go. I'm checking the complement, and you can see the complement is, it's fully diluted, or there's no clamps at all on the complement. You can see the cell basically become one with the liquids, right? And this one, you can see the clamping on the tube wall if you pay attention. It's hard to make you see, but you get the idea. So now you do a DAT. This is a review. You do a DAT to find red cell coated RBC, and you will use a Pali. And if you're anything that's positive in a Pali, you will want to find out if it is IgG or C3D complement. And that's what I did for you today. So now if you like those type of videos, I can continue to make them for you in different area in the laboratory: blood bank, chemistry, hematology, coagulation, urine analysis, except micro. I've not been in microbiology since quotation a long time, but I've been a generalist for a long time, and I've been working in blood bank, urine analysis, chemistry, general chemistry, and coagulation, and so forth and so on. So if you like those type of video, make sure you subscribe, share with your friends and family. If you're about to take your board certification ASAP, you have questions, do not hesitate to send them in the comments, and make sure you go ahead and tell me what will be the next step after you find the positive DAT, either it's complement or IgG. What will you do? So put them in the comments and keep them coming. And then if you love those videos, let me know. I can continue to bring those kind of video for you, and most of them will have SAP board certification questions. And then peace.